Okay, guys. Hey, this is Dr. Dickerson, and once again, it's time for getting the skinny. This time, we're going to compare some weight loss medications compared to other ones that we have. We have used semaglutide in our practice now for a couple of months, and we're very happy with the results. So, we wanted to share with you some of the other things that we are doing when it comes to just going ahead and other options for you for weight loss. So once again, this is the second of our two-part series. We're now going to be comparing some of those weight loss medications, and don't forget to stay tuned. We'll be maximizing our results with these medications to give you your best goal weights. So essentially, how do medications work? Well, we want to promote some sort of negative energy balance. You can see that if we just have an even energy balance, we're not going to lose weight or remain stable. If we do provide something where we'll get a positive energy base, well, we'll get a weight gain. So we're taking in more than we're burning off. And the opposite of that, of course, if we're burning off more than we are taking in. Obesity is once again a very understudied, condition. And we're going to talk about the difference between how we're even going to handle the obese patient versus the patient who just is overweight and just wants to lose some weight. So how do these drugs work? Well, they're in categories. So one of them is to reduce hunger. If we're not hungry, we don't eat, of course. The other is if we're already feeling full. If we're feeling full, we don't eat. The other thing is if we do eat, how can we basically decrease some of that absorption so some of those extra calories aren't getting in? What are those medications that increase energy expenditure? And by doing that, some of these will actually stimulate, our activity, whether it's just fidgeting, exercise, increasing our metabolic rate, or even thermatogenesis, which is increasing our temperature to burn off some of those calories. So obesity medications, let's look at that first. Now, these are medications that are approved or seen to work well in long-term use. We're not talking about the quick fix. We're not talking about for a couple of weeks. Once again, obesity is a chronic disease. And whatever we're trying to do, we're trying to improve health, quality of life, and of course, decrease body weight. Now, for those medications for weight loss for the overweight patient, this is once again a tool. It is just a tool. It's usually a tool of a comprehensive treatment plan that we're trying to use in conjunction with other tools. This includes nutrition, physical activity, and of course, behavior therapy. One of the biggest questions that we get answered is over-the-counter versus prescription weight loss. Is one better? Well, let's go over that briefly. And once again, guys, this is a brief overview of these medications. It's not basically down depth where we're getting a lot of information. We want to make sure that you guys talk to our providers so that we can get this information to you. But the over-the-counter medications, these are usually appetite suppressants. They help control our hunger and our cravings. They also give us an opportunity, once again, a tool that'll help us stick with our nutrition and exercise plan. One of the most common ones that we've seen is something called Ali or Orlistat. This is the only FDA-approved over-the-counter medication for weight loss. And how does it do it? It blocks the body's ability to absorb fat. All of the other ones, or the over-the-counter appetite suppressants, are once again considered supplements, if you will. And then, of course, the prescription medications versus the over-the-counter. This is a healthcare provider that's providing a medical evaluation and or history and or finding out what are the best indications or, more importantly, the best tools to help you with your weight loss goals. Ali, one of the most common ones that are out there that we're seeing. It comes in a capsule. It's taken orally. It's what we call a lipase inhibitor. It inhibits fat absorption in the intestines, and it is approved for long-term use. Side effects include a little cramping, passing a little extra gas, sometimes leaky stools, oily stools, foul-smelling stools. So we want to basically talk about those to our clients so they can, take some precautions. And of course, combining this with a low-fat diet helps maximize those results. Same medication in prescription form is called Xenical. So what FDA-approved medications suppress appetite? So let's look at a group of medications that we've seen that have been around for a while called stimulants. These are for short-term use. Once again, short-term use, a couple of months at most. Here's just a list of some of the more common ones. This is not an exclusive list. Most people understand or have seen phentermine, femfast, femfem, and even combining them with some other medications like Quisma, so that which is an migraine medication along with the phentermine. And what that tends to do is it helps even alter some of the taste of our food. And what I want to make sure we're driving home the point. These can have some side effects. That's why they're only used for short-term use. We want to make sure for those individuals who have high blood pressure or heart conditions, this is not the tool for you. It is an amphetamine-like product, so we do have to talk about that there is a risk of dependence, hence the reason why we want to put this on short-term use. The other one that you've seen out there in social media, commercials, are your GLP-1 agonists. We're going to go for what that actually does and what that stands for. Glucagon-like protein is what the acronym is for. And this is used for longer-term use. Up to 20% of weight loss can be done per patient based on the studies. Now, so what does that mean? If you're 100 pounds, you can lose up to 20 pounds. If you're 200 pounds, you can lose up to 400 pounds. And once again, this isn't a list of not all of them that are out there, and there's even some that may be coming out soon. This is your Saxenda, your Quisma, your Wegovy, and you can see the last one on there is for pediatric use, even for kids that are young as 6 years old who have chronic weight loss issues. Now, our glucagon-like protein, one hormone, what that does is it helps work on a hormone that's already in our intestines. It helps regulate the blood sugar, stimulate insulin secretion a little bit more, squeezes a little bit more out of the pancreas, therefore having us the ability to digest our food more, or I should say better and more efficiently, as well as decrease those high sugar spikes for those individuals who are type 2 diabetics. It helps better us take up the glucose in the cells for energy and promotes muscle building. So semaglutide is, once again, what we've been using in our practice. It probably has the least amount of side effects, some of the best studies that are out there for long-term use. If this was a medication, once again, some of the name brands can be cost up to $1,500 a month. We have a program that is at $375 a month. Once again, it is just a tool for your weight loss. See if you're a candidate for it. We will provide an evaluation and management. We usually do not have to run labs for this unless there's other indications during your evaluation that we see. We do not accept insurance for this. We are seeing more and more of our patients who are being denied for their semaglutide in their name brand usage. We use a compounding pharmacy that's accredited to get ours to get the results that we want in a more cost-effective means. So I hope this basically gives you just a quick down and dirty of comparing some of those weight loss medications. Stay tuned and look in the future for maximize the results where we can do those other things, maximize those tools, sharpen those tools to give us our best results for our weight loss. I hope to see you guys soon. Make sure you click to schedule your virtual inpatient consultation. And once again, have a great day. This is Dr. Dickerson. See you soon, guys.